Hi, I'm Jocy Nerey. I am 47 years old and I live in Miami, Florida. I am a pre-K teacher for the past 19 years. I have two lovely children, 19-year-old son and a 15-year-old daughter, and a wonderful, supportive husband since I was 16. And we've been 23 years, lovely, crazy life together. And now we really know what our vows mean, in sickness and in health. So I would do all my mammograms every year at a Baptist health facility. So every year I would do it there. So like that, all my records would be in one place. So when this happens now with my last mammogram, they were able to compare all the years that I had.
The earlier we're able to detect a breast cancer, the more options there are and the higher the chance of cure.
We had COVID. So I always do my mammograms every summer, and that specific year I was a few months behind, no more than 6 months, and I happened to feel a lump in my breast.
So she had a lump in her breast and she had some calcifications in her breast that were noted on the mammogram. And at that time when I saw her, I did her biopsy in the office that diagnosed her cancer. So after a thorough workup, she had additional biopsies of both breasts actually, because the abnormalities were seen in both breasts, and she was diagnosed with multiple cancers in one breast and atypical lesions in both breasts. Definitely needed a mastectomy on the affected side, but she chose to have a contralateral prophylactic mastectomy because she had high-risk lesions as well.
We've got this, you have options, we have treatment for this. You're going to be okay.
So when she had her mastectomies, she had a sentinel node biopsy, which is where we go in and sample the lymph nodes where her breast drains to. And at that point in time, we found the cancer in the lymph nodes.
As a cancer patient, I had to learn to be patient. Lots of patience, because things change and it's not always what you think it's gonna be. And that's okay, because you wanna make sure you get the best path, get on that right path to make sure that all the cancer is gone.
When we got her pathology back, she had three different invasive cancers in her left breast. Two of them had the same tumor marker profile. So for example, estrogen and progesterone and the HER2 new protein were the same for two of the tumors. The third tumor was what we call HER2 heterogeneous.
With the support that I had from my husband, from my children, from my family, from friends, from my doctors and the team here at Miami Cancer Institute, massage from the oncology team here at Miami Cancer Institute. Baby steps every day help me move forward.
Well, right now she's cancer-free. She was always very good about, getting her screenings, but the earlier we're able to detect a breast cancer, the more options there are and the higher the chance of cure.